Hi, my name is Hannah and I'll be demonstrating today how to do a PCA bag change with medication and morphine. So first things first, I'm just going to wash my hands and I'm going to compare my doctor's orders with my MAR. So my right patient is Marcy, FIN number 123, 123, 456, 456, 789, 789. There's no known allergies. And the right medication that's ordered is morphine 1 milligram per ml. The dose is 1 milligram, 1 milligram. The lockdown interval is every 5 minutes, and the right time is now, and the right route is PCA. So that looks good. It's been signed off. I'll put the doctor's orders away, and then I will head to my monograph to review that. So I have morphine sulfate. It's a high alert medication. It means I need 2 nurses to check with me. That doesn't include myself. It can be administered by a student nurse via PCA. I'm looking here at the normal dose, which is this dose that's ordered is the normal range. And it's compatible with normal saline, which is what I have here, what I'm going to be putting my morphine in. I'm going to be monitoring for any types of respiratory depression, nausea, vomiting, palpitations, any type of side effects. And I will be monitoring the vital signs and blood pressure pretty steadily. I'm looking here, I do not want the glycolic pump, I would like the PCA calculation here. And the lockout interval is within the normal range as well. Check that. So it says here from the recipe, for rates of 1 to 10 milligrams per hour, which is what I have, I want to draw 50 milligrams, so I'm going to grab 5 10 milligram per ml ampules and draw 5 mLs up, and then add that to 45 mLs of normal saline for a final volume of 50 mLs and a final concentration of 1 milligram per ml. And I'm making sure that my PCA reflects this concentration. So that looks good. Next I'm going to grab my 5 ampules and verify against my monograph and my MAR. So I have 5 10 milligram per ml ampules here. So my right patient is Marcy, my right medication is morphine sulfate. So I have morphine and I have checked morphine. So that looks good, right drug. I reviewed the monograph for this high alert medication. The right concentration they want me is 1 milligram per ml. This is 10 milligrams per ml, but I will be taking the 5 mLs from each, or an ml from each one, and diluting it into my 45 ml bag of normal saline. So that will give me a final concentration of 1 milligram per ml, which is what the doctor ordered. So that's the right dose. The right route is PCA. I have my PCA MAR here, and I verified according to the monograph that I can do a PCA, and this is IV medication. And I have my bag here that I'm putting into. The right route, the right time is to be given is now, and the lock interval is 5 minutes that I will make sure I note on. So that looks good. Next, I'm going to draw up my 5 mLs. I'm going to first draw out my 5 mLs of normal saline from this bag before I slips my mind. So I'm swabbing for 30 and drying for 15. I just have it sitting over the edge here so I can maintain sterility. This end typically wouldn't be popping out this time, so new package, and I'm going to wing it back to maintain sterility. And pull it back here, and I'm winging this back as well. Alright, and I'm going to be withdrawing shaky. Perfect. And I have my label to label it 5 mLs of normal saline, so that when my second nurse does their check, they know what this liquid is in here. So I have 5 mLs of normal saline here. I'm going to put that to the side, and then I'm also going to pull out. So there's 45 mLs of normal saline in this bag now. And I'm going to pull out and grab my morphine now. Bringing back the package. Typically I would use a filter needle, but for demo's sake I will be using just a normal blunt fill. And I'll be pulling up an L from each one of these.
So let's start off with right page, so Friesen
One here.
and so when there's an allergy,
Typically these would be filled for 1 ml, but they're a little bit overfilled and underfilled, so we're going to try and get 5 mLs out here to the best of our ability.
Let's double check. I have 100, this is 100 vial.
This is empty.
And then I have the 1 ml, which is my 1 ml. And then 100 ml normal saline. So this is my normal saline right here, and it's 100 ml. And that's what would be the quantity once I put my drug into my bag. And final concentration is 0.99 units. So what's most important here is that I'm also going to discuss my actual plan. So we are using a continuous IV, recipe with morphine
This last one here.
and we're going to be using it 2 units per time. Okay? So again, that will allow me to do that based on that recipe. So what I would then get my nurse to do is have him come and make sure this is all correct. He says I do absolutely perfect work.
Right,
So
and I have 5 ml, so I'm just going to label this now with my morphine.
is that
So I have morphine 50 milligrams for 5 ml, so my second nurse knows, and I'm going to put these in the waist. Alright, and now I will be doing, I also have a label for my bag. So I have my, here's my label, my bag. So my drug is morphine. I have a dose of 50 milligrams that I'll be injecting into the bag. A volume of here of 5 mLs. There's 45 mLs currently in this bag because I withdrew 5 mLs of normal saline. And I have a final concentration of 1 milligram per ml. And the bolus is 1 milligram, the lockout is 5 minutes, and there's no continuous infusion noted on the doctor's orders. So that looks good. I will now compare it to my MAR, my monograph, and all of my ampules, syringes, and bag. So my patient is Marcy Paris. I have Marcy Paris labeled here. I verified the FIN number. She has no known allergies. The drug that's ordered is morphine 1 milligram per ml. And I reviewed the monograph for morphine. I have morphine here in my syringe. So it's morphine 50 milligrams. And I have morphine 10 milligrams per ml here according to my monograph recipe. And I have morphine labeled here. The right dose is 1 milligram. These are 10 milligram per ml ampules, and I have 50 milligrams here, but I'm going to be diluting it into my 45 mLs of normal saline, so I'll have a final concentration of 1 milligram per ml, which is what my recipe calls for and what is stated on the doctor's orders. The right route is PCA. I have a PCA MAR here. I reviewed that I can give it PCA according to my monograph, and these are all IV medications that I verified, and the right time to give it is now. And I'm looking here that there's a 5-minute lockout interval as well, and there's no continuous infusion ordered. So that is good. So now I will be putting my MAR, and I'll get my second nurse to now verify this, and she has verified that this is correct. So I will inject my morphine into my bag, and then I will head to the bedside for my final checks. So I'm swabbing again for 30, drying 15. I'm going to inject my 5 mLs into my bag. Withdrawing. And then I've been putting both of these into the sharps container and this into the med waste. The sharps, I guess, as well, because it's glass. And I'm just slowly do this, and then I will head to the bedside with my second nurse. So knock, 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 doing a general check on my way in. Hi, my name is Hannah. I'm a student nurse looking after today. Before I proceed, I'm just going to do one last check of the wristband here. So I have Marcy Paris, FIN number 123 123 456 456 789 789. And can you state your first and last name for me? And do you have any allergies? Wonderful. What's your birth date? Great. So he has no known allergies, and that's all been verified. So I have the right patient. The medication that's ordered is morphine 1 milligram per ml. I have morphine in my bag. The PCA dose is 1 milligram. I have 50 milligrams in my bag, but because it's diluted, I have a final concentration of 1 milligram per ml, which is what the doctor ordered. The right route is PCA IV, and I have an IV medication, and I verify that I can give it PCA. And the right time to be changed is now. So that is good, and it's logged every 5 minutes. And wonderful. Alright, so I'm just going to wash my hands again. I would have washed my hands before I took the wristband as I entered the room for future reference. So the doctor ordered for the PCA bag to be changed. Looks like we've been having this for a while. We're going to be continuing to monitor you to make sure your pain is well controlled. We'll be taking your vital signs pretty steadily as well, and we'll monitor you for any signs of respiratory depression, nausea, vomiting, anything out of the ordinary. Make sure you just alert us so we can check in on that. Do you have any questions about this? And is it okay if we give you this medication? This is going to help to maintain your pain management levels. Okay, that's okay. I've got consent, so now I will head over to the pump here. And turn it on. I would use my key to unlock it because it should be locked up. I would note the goods and demands that were in the bag previously, and I would document that. And if there was waste, I would get my second nurse to waste with me, or my 2 nurses because I'm a student nurse. Just turn this on here, and then I'm going to be, when I put this into the pump, I'll be looking at my bag and my MAR to make sure that I have the right information in. I'm also noting that there is currently currently a carrier running right now. And it's all looking, it's all unclamped, and the site is doing well and good, accessible. So I want to program yes. The code is in the back here. I have 94629. 4629. Okay, so my units here, I have milligram per ml, so 1 milligram is units, that's good. The concentration in my bag is 1 milligram per ml, so I want to put 1 milligram per ml, yes. The admin rate or route is IV, my medication I have here. The loading dose, there is no loading dose, I'm going to do 0. The med limits are going to stay off for safety. Yes, I'm going to hit next. And then, yes, okay. The bag volume, I have 50 mLs in total because I have my 45 mLs of normal saline and my 5 mLs of morphine, so I have 50. My basal rate, there is no basal rate. The patient bolus, every time he hits the button, he's going to get 1 milligram of morphine, and he can hit the button, or like he can hit the button as much as he wants, but he'll only get medication every 5 minutes. And so then he'll get a total of 12 boluses per hour if he wants to. And I'm going to hit yes to be done. Then I would get my second nurse to review this. She would hit no to review and then verify that it's been correct, and it says that it's correct. So now I will go ahead and I'll change the bag. So take this guy off here. Making sure I'm maintaining sterility.
Before I confirm, I need to put
Spike my bag here. Hanging this up. I would lock this all up so no one can access it, and then I would press run to start.
So again, clean for 3, let it dry.
Making sure that the green light is going. I'm making sure that everything is unclamped, so it'll all be closed up. And then I would be documenting on my MOR with my other nurses that checked it off, that I changed the bag and I beat my destination as well as the time that it was changed. And then I'd be continuing to monitor my patient for any signs of distress. I would also put this away and making sure the patient's comfortable. So here is your PCA button as well as your call bell in reach. So if you do feel like you're in pain, just hit this button. Make sure that only you hit the button, not your family members at all. If you can predict that you'll probably be going up to go to the washroom or something that's going to be more painful, you can hit the button ahead of time and then you'll get the medication. That should ease your pain. Do you have any questions regarding this at all? No, you're good, you're comfortable. So I do a C-check on the way out, and I would gather my MOR and all my supplies and